So we are so excited that Pam Clark and Myrna Martin are with us today to get state-approved first release on the upcoming direct service worker policy. Ladies?
Thank you.
Wow, Sunny May, thank you. Are you guys still with us? The pasta is kicking in for me. So I'm really trying to, I'm not gonna fall asleep on you guys if I off the podium. But I wanna thank you for giving us your undivided attention again this afternoon. So as she mentioned, this is really just the highlights. Myrna and I were a team. We were handpicked by Carl Ellison to attend the Indiana DSW State Plan Project. So we are basically just gonna plant the seeds, and as this develops, you're gonna hear more about it. So is there anything you'd like to add? Okay, so let's go to our second slide. So as we go through this presentation, if you can think about someone that is a caregiver, that is a CNA, someone that, a direct service worker. If you think about some of the challenges or think about some of the things, the conversations that you've had with them, I know I've seen CNAs that are my friends, that I've seen some of their challenges, some of their struggles that they've shared. So, and this plan is basically going to address basically all of those issues. So, I forgot to mention that when we were attending the planning project, the state plan project, there were 6 buckets. So I'm going to quickly name those buckets. It was recruitment, training and regulations, wages and benefits, retention and career development, workforce data and tracking, and the last bucket that we discussed was social and other supports. So I want to start with, what is a direct service worker? A direct service worker is someone that is a caregiver, it's a CNA, it's someone who takes care of someone who may have a disability, someone may have mental issues, someone who may be your loved one. I know I care for all 4 of my family members. So I want you to think about that as we go through the presentation. Next slide, please. Who are direct service workers? Well, I think Carl Ellison did an excellent presentation on addressing some of the issues that we're going to be facing down the road. So we're going to need more direct service workers. In 2030, you don't have to raise your hand, but 1 in 5 people in the U.S. Will be age 65 and older. As I said, you don't have to raise your hand, but you may need some, don't laugh. You may need some help along the way, even if it's assisted living. You may need some help. They also mentioned earlier, Carl mentioned that 4.5 million DSW workers across America today. So we're going to need more DSW workers. So if you think about DSW workers and some of their challenges, and you think about how can we increase some of their skills and how we can make increased pay and benefits, we're going to go into a little bit of that later, DSW workers. What are some of the challenges? As I said, some of it's the pay, it's the benefits, because most of them are single moms. And then when you start talking about going to the doctor or taking over work, you're paid hourly, and you have these challenges of, can I get to the doctor to have my mammogram? Can I take my child to daycare? Can I afford daycare? So there are some challenges that the DSWs have along with, I'm not saying all single mothers have challenges, but most of the time you have to look for someone to help you with daycare. You also may have your car, you may need some help repairing your car. So not just that, but sometimes you can't afford your copay. So there are a lot of challenges, as I said. Myrna's going to go into some of those as we go through this presentation. And I just love this lady.
Hello, everyone. So the first thing that we wanted to identify, and Pam kind of touched on it earlier, wanted to make sure if everyone was paying attention. But the question goes, and we know that nothing gets old but your clothes, but we wanted you to understand the importance of this new program and policy that is getting ready to take place and why it's going to be so effective. So by 2030, 1 in 5 people in the US will be age 65 or older, and we threw that in there to see if people were paying attention. Is that true or false? True, yes, that is, because this is where the DSW program is really gonna highlight, because we're identifying the needs of people 65 years and older that will have specialized needs that will be at home. And as the state is just transitioning from the senior living to home living and having people getting more assistance in their home instead of moving towards senior living. Next slide. How do we address these issues? That is the question. So DSW Workforce Realities, we know that legislative is essential to strengthening the DSW workers, and funding. Funding is very important, and that's what we have issues with. We are making sure that we attend these meetings, making sure that we attend these, all of these meetings to help with understanding the importance of DSWs, and also recognizing that DSWs are mostly women. Not only are they women, but they're disproportionately women of color and mostly immigrants. 2.8 million women have been identified as women of color and immigrants that support the DSW program. So imagine that. One of our buckets was that we're recognizing that these women have barriers that they face as well. They face barriers, and Pam talked a little bit about making sure that they have transportation, making sure that their living expenses are paid, making sure that they are able to provide the service, but also they're also in need of services as well. So those are the things that we're trying to identify and finding ways that we can support them while they are working as DSWs. So recruitment, that was one of our buckets. We discussed that it is important to identify the age group and also people that will benefit as DSWs. So we identified that public high school students we can provide a training that can help them to be prepared for this high demand that's coming down the line. So recruitment, we're looking for different ways that we can recruit different people, not necessarily going after women. We have found that it's, like we said, it's 2.8 million women that are already DSW. So we're looking for students and people that can provide this and help with this gap, actually. Wages and benefits, that was one of our biggest issues because 84% do not have access to employer-sponsored retirement benefits. That was a hard one because we realized that most of the women that are providing DSW services are receiving services themselves. Next slide. What can you do in your local community to help this initiative? We identified that you can host town hall meetings, community discussions, things that we're doing here today, capture stories from caregivers and DSWs, which is very important. You get to find out firsthand the importance of the job of a DSW and how it affects a caregiver. Connect families to local resources, partners with schools, health, and health academy teachers, connect with your local state legislatures, and partner with local FSSA. And also identify champions within your community that are advocates for this program. All right, back to our true and false questions. Just a little something to wake you guys up. So do you believe that disparities are prevalent for both the substantially Black, Indigenous, and people of color workforce for people who actually receive services as well? That is true. Both people providing services as DSWs and the people receiving services are both in need. They both are affected by disparities. DSWs or DCWs, depends on what state it is, so it can be referred to as direct service workers or direct community workers, are mostly women, disappropriately women of color and immigrants, and we talked about that. So yes, that is true. Next slide. So we just wanted to bring you a little bit of a snapshot of what the policy is taking place right now. It's not over yet, we're still in discussion. Pam and I had the fortunate opportunity to sit in the room and listen to all of the different buckets being addressed. We had a lot of conversation, and we are moving forward to figure out how we will roll this out in Indiana so it is effective for both the DSW workers and the people that they will serve.
So I have a quote from Dr. Martin Luther King. Commit yourself to the noble struggle for equal rights. You will make a greater person of yourself, a greater nation of your country, and a finer world to live in. Thank you.
I also wanted to add that at the end of the slide was a barcode that we really wanted you to participate in. I don't know if your phones can read it from there, but it's just a survey question so that we can get some more information about what do you think about the DSW program, the little information that you received today, if you can kind of answer some of those questions so that when we do have our fall meeting with FSSA and the Bowen research, then we can probably bring that information to them as well. Thank you.